topic of choice for our group is ethical decision making. And my name is Jessica McCall. My portion, I will be defining the role competency for ethical decision making. Everyone that is in the medical profession has encountered some type of ethical decision making issue. Nurses interact with the patient and family a lot, therefore the moral position of nursing in the healthcare arena is distinct. Healthcare is increasingly becoming complex and the issues are intensifying, so the role of the advanced practice nurse becomes very important in the identification, deliberation, and resolution of complicated and difficult moral problems. Even though all nurses are moral mediators, advanced practice nurses are expected to be leaders in recognizing and resolving moral problems, creating ethical practice environments, and promoting social justice in the larger healthcare system. A problem becomes an ethical or moral problem when issues of core values or major responsibilities are present. An ethical or moral dilemma occurs when obligations require or appear to require that a person adopt two or more alternative actions, but the person cannot carry out all of the required alternatives. Besides ethical or moral dilemmas, there are two other types of moral problems from the classic moral dilemma, which include moral uncertainty and moral distress. Moral uncertainty may be when a nurse experiences unease and questions the right course of action. Moral distress is when a nurse believes that they know the ethically appropriate action but feel compelled from carrying out that action because of institutional obstacles. For example, lack of time or supervisory support, physician power, institutional policies, legal constraints. The three general themes comes from when ethical issues in nursing practice are examined. These are problems with communication, the presence of interdisciplinary conflict, and nurses' difficulties with managing multiple commitments and obligations.
Hello, my name is Melania James, and I will be discussing the core competency of ethical decision making. To operate in the role of advanced practice nurse, one must exhibit leadership in decision making. Practitioners must possess the knowledge and skills to avoid power struggles, engage in interdisciplinary communication, and facilitate consensus among the members during difficult ethical situations. Ethical decision making is organized in 4 phases, each dependent on each other. The first phase begins with knowledge development. The nurse practitioner must have knowledge in ethical theory and principle. The exposure to ethical theory aids the practitioner in the language necessary to articulate ethical concerns. Next is knowledge application. You must apply the knowledge gained from theory to actual practice environment. Applying ethics during the decision-making process helps the APN respond to practice dilemmas in an appropriate manner. Next, creating an ethical environment. This phase is for the nurse practitioner uses knowledge and application to function as a role model for other staff members and their clients. Advanced practice nurses should always facilitate an environment that promotes the use of moral values. And lastly, promoting social justice in the healthcare system. The involvement of the practitioner is to respond to the larger need of their specialty. All nurses should assert themselves in social advocacy for the patient and for the nursing profession.
Hello, my name is Sheila Rutherford, and I'm here to discuss the characteristics and traits of ethical decision making. APNs and nurses, especially advanced practice nurses, are held at a higher standard and are required to demonstrate the characteristics of caring, honesty, integrity, and compassion. The APN in this role works in various settings, so it's required to demonstrate these characteristics. Nurses are expected to be moral agents in solving ethical dilemmas within for the patient's families, and also within their co-workers, the interprofessional conflicts that may arise. APNs are required or expected to be the moral agent to settle the ethical dilemmas. Also, the APN must be able to navigate communication problems. There are three things in the characteristics of ethical decision making. The first thing is communication problems that are encountered in most ethical dilemmas. Is the erosion of open and honest communication per Hamrick et al. Most ethical disputes are the result of inadequate communication and not the result of a difference in valuing. Also per Hamrick. APNs are required or expected to utilize specialized communication skills to address ethical dilemmas whenever they arise. The second thing is the interdisciplinary conflict. This is conflict that occurs within the multidisciplinary team. APNs, advanced practice nurses, serve on multidisciplinary teams with the doctors and other specialists, and there is ethical dilemmas may arise within the multidisciplinary team with their thoughts of practice or also with their values. So the APN is called on to utilize their specialized skill of being able to communicate and solve ethical disputes. Finally, multiple commitments. APNs work in various settings and are required to have various commitments towards the specialists, commitments towards their patients and the families. So the commitments and being the obligations that APNs face are another factor in another trait of ethical dilemmas, decision making.
Good afternoon. My name is Brandy L. Lane, and Shamika Calhoun and I will be covering ethical decision making in APR practice and giving examples. As you all know, APNs are expected to be leaders in recognizing and resolving moral problems. So we have come up with some very interesting ethical dilemmas. We want the audience to listen and think about each scenario. After listening, decide on what you would do if faced with a similar ethical dilemma. Scenario number 1. You work as an acute care nurse practitioner along with surgeons in a level 1 trauma center. Your colleague, who is an esteemed, well-known, and well-respected surgeon, makes an appointment to be seen by you during clinic hours. He squeezes time out of his busy schedule of performing invasive procedures and surgeries to come see you for a routine checkup, or so you assume. After talking to him for a few minutes, you sense that he is holding something back from you. After a few minutes have passed, he tells you the real underlying reason for his visit. He is concerned because he had an extramarital affair while on his boys-only trip to Las Vegas with the beautiful exotic dancer. He wants to be checked out just to make sure he is okay since he had unprotected sex. He feels a sense of trust with you. So you order a routine chemistry, CBC with diff, hepatitis panel, and HIV 1 and 2. To your horror, his HIV test comes back positive. He breaks down in your office crying inconsolably. He begs you not to report him to the Department of Health. He knows that if it got out that he had HIV, he will lose the respect of his colleagues, his career could be over, and his wife may divorce him. You also know that not reporting him could be putting patients' lives in jeopardy. Patients deserve a say in the matter as well and have to consent to being treated by a practitioner with HIV. So, what would you do? Scenario number 2. You have been childhood friends with 2 women that come from a really good family. They are sisters. They are both hardworking women, and they live right down the street from you in the same neighborhood. You are an NP with your own successful practice. The sisters oftentimes ask you for general medical advice, although they are not patients of your practice. Unfortunately for sister number 1, She loses her good job because the manufacturer has decided to relocate the plant to China. She is a single mother of 2 children. She has malignant high blood pressure that responds well to medication therapy. Without insurance, the medication is extremely pricey. Sister number 2 works and has a great health insurance coverage plan. She too suffers from high blood pressure. In a desperate attempt, the 2 sisters stop by your house, as they often do, to talk to you. They tell you what is going on with sister number 1. Concerned about the stress of the sister being laid off, they are both worried that her blood pressure will skyrocket once her medication runs out and she will have a stroke. They ask you if you will write a prescription for sister number 2 for the blood pressure medication, knowing that she will be getting the medication filled under her insurance plan and giving it to sister number 1. You are concerned about your childhood friends, but you also know that what you would be doing would be unlawful, jeopardizing patient safety, committing Medicaid fraud, just to name a few. Plus, you have never seen or treated either sister in your practice before. They promise you that they would not never tell a soul, and you do know other practitioners that have prescribed medications for colleagues before. So, what would you do? Next, Shamika Calhoun will discuss her scenarios with you.
My name is Shamika Calhoun, and I will be giving more examples of ethical decision-making in the APN practice. Is it ethical for practitioners to lie to their patients? It's not uncommon for a family member to demand that their loved ones not be told about a terminal illness. It is also equally tempting for a healthcare professional to embellish reality by telling a patient they are worse off than they actually are. For instance, a practitioner has been caring for a patient for several years. In the initial interview with the patient, the practitioner discovers that the patient drinks alcohol on occasion and has done illicit drugs in the past. Over the course of the provider-patient relationship, it becomes apparent that the patient has increased his consumption of alcohol tremendously and has become addicted to drugs. The practitioner, of course, discusses the effects of alcohol and drugs to the patient and explains that they are detrimental to his health. The patient verbalizes understanding but continues with his destructive behavior. The practitioner is obviously concerned about the patient's well-being, and on the next visit decides to tell the patient that he has end-stage liver disease. The clinician knows that the addiction can eventually kill the patient in one form or another. Therefore, is it ethical to lead the patient to believe he is dying now, even if the motivation behind the lie is for the good of the patient? Scenario number 2. The NP is scheduled to see a patient who has been a client for several years. The NP remembers this patient has recently had some issues with depression as well as some marital problems. During the course of the patient interview, the patient begins to describe his most recent episode of depression. The practitioner listens and takes notes when necessary. Suddenly, the patient begins to explain that he recently forced someone to have sex with him. Should the patient's confession be a verbatim part of the medical record? Is the confession pertinent to the medical care of the patient and therefore necessary to be placed in the medical record? From a legal perspective, are conversations between a patient and his clinician truly privileged? There are 5 principles to guide the healthcare provider in making ethical decisions. Number 1, respect the autonomy of the patient as well as the family. Number 2, balance the benefits with the burdens of therapy. Number 3, attempt to do no harm while providing benefit to the patient. Number 4, seek justice, such as those who are poorly educated or do not have access to healthcare insurance are not deprived of resources of the healthcare community. And number 5 is to maintain integrity and veracity in the professional relationship.
Hello, I'm Brittany Gilliard, and I'll be discussing what the current research says about ethical decision making in the practice of the advanced practice nurse. There has been conflicting information and research about the readiness of the advanced practice nurse in ethical decision making. One consensus is that being prepared or taught how to make an ethical decision promotes confidence in the practice of the advanced practice nurse. It has been argued that moral reasoning cannot be taught. but a study by Canners and others in 2014 found that ethics education contributes to ethical reasoning competencies and practice. Another study completed by Labs in 2015 shows that ethics education has a significant positive influence on moral confidence and moral actions by nurses. The confidence that comes with this core competency, placed in practice, can lead to enhanced care. A study completed by Orridge and others in 2014 found that practitioners who feel prepared and confident in ethical decision making perceive that they provide a higher quality of care, while the practitioners who are less prepared feel less autonomous and perceive that their quality of care was lower. The lack of being prepared on ethical issues leads to a lack of confidence and a perceived lower quality of care. It can also lead to moral distress in the advanced practice nurse. So the question is, who is to prepare the advanced practice nurse to deal with these issues? In a study completed by Labs in 2012, research shows there are extreme variations of ethical preparation at the graduate level. In a review of studies by Hamrick and others in 2014, there is compelling evidence of the need for phase 1 ethical decision making and knowledge development in the graduate curriculum. Although there is not much research on this core competency and its outcomes in practice, research findings suggest that investing in education may improve collaborative practice, teamwork, and quality of care in the advanced practice nurse.
Hello, my name is James Lee, and I'm just going to give a conclusion to our group's research on ethical decision making and how it's significant in role competency for nurse practitioners. It's easy to see after listening why being prepared for the necessity of making moral decisions as advanced practice nurses is so important. Hamrick included this role competency for a reason. Ethical decision making is going to happen. We're going to face it. And we'll sleep better at night if we know we have handled every situation thoughtfully and in a competent manner. This competency is significant because it's multifaceted and involves a variety of skills. The advanced practice nurse must be able to facilitate communication, overcome the conflicts among disciplines, and balance all the pressing obligations a nurse faces. These moral conflicts and dilemmas that arise can take diverse and often unexpected forms. The current research regarding this role competency emphatically indicates that preparation is the key. If we have given ourselves the mental and emotional tools whereby knowledgeable decisions can be made, the results are better care and improved outcomes. It is highly advised that every advanced practice nurse master the art and science of making challenging ethical decisions. We thank you for your time.